Mr. Mayor, can you hear me?
I can hear you.
Okay, it's 7 o'clock on the dot. I wanted to put this slide up as people come in to let them know that we'll be hosting one-on-one tech support all next week. So in the chat, if you would like to have an appointment for one-on-one help, just put the information in the chat. We'll be following up and scheduling one-on-one tech support. You know, Mr. Mayor, one of the things that we learned is that the same bumps in the road that many Americans experienced at the beginning of this pandemic in signing up online for the vaccine exposed the challenges inside of our internet capabilities at so many levels. And so that reality is also present around the country with our barbers and stylists. And so while there are bumps in the road to get them on the information highway, once they're there, they'll be set. And so we're actually building out infrastructure to the community that is and can be sustainable. So we're very, very pleased. We have done these one-on-ones. I want you to know that we hear you out there and understand some of the frustrations of navigating this computer dynamics. Just to reiterate, we'll be providing one-on-one tech support all next week to accelerate our effort to get our barbershops and salons ready to fully participate in Shots at the Shop.
Well, let me begin by welcoming all of our barbers and stylists to our orientation today. And of course, I'm excited because we have the Alabama contingent present and accounting for. You know, anytime I can promote Alabama, that's what I do. And I do it, I'm very intentional about it. I make no hesitation or reservation about the fact that I love the state I was born in and where I live. And so we have today Dr. Scott Harris. He is the acting state health officer for the Alabama Department of Health, Public Health. And Dr. Harris has been on the You Got the Power show on more than one occasion, and he always come across in a way that's palatable and that's respectful, even as people are challenged with, you know, their reservation and equivocation about vaccines and their hesitation. He's very patient with people. And so a person who's worked with patience, obviously he has patience. And so we are so appreciative to have him join us today as we talk about the new Delta variant and how do we reframe the issue to make sure that more people can embrace what we're doing with a strategy to take care of ourselves. And we also have Dr. Karen Landers. Dr. Landers is a new friend of mine. She's my new best friend. And Dr. Landers is the medical advisor for the scientific response section of the media team for the Alabama Department of Public Health. She was on the You Got the Power show on yesterday, and I got some rave reviews, as I did with Dr. Scott Harris. I want to make sure that we say that as well. But I got rave reviews on the way that Dr. Landers was able to really break down those complex issues. You know, for those of you who live in the public health space and the medical space, this is your, you know, this is your stumping ground. You're comfortable there. But now everyone has to do a crash course on public health. And that's not so hard. So the learning curve is steep for many people. And so when you're able to break down information where it makes sense to people, I think that's very important. And so it's so good to have both you, Dr. Scott Harris, and you, Dr. Karen Landers, to join us at Shots at the Shop. If we didn't tell you, this is a White House initiative, and we are trying to do our very best to engage us. We want to bring in Dr. Reed Tuckson and elevate him now into the place. Dr. Tuckson is one of the co-founders of the Black Coalition Against COVID. He is the White House kind of liaison for us. And Dr. Tuckson and I were just together as the descendants of the Tuskegee syphilis study, or the public health study conducted in Tuskegee on Tuesday on Howard University's campus. And it's a beautiful campus to which Dr. Tuckson is on the board of trustees there. And Dr. Tuckson, welcome as well.
Well, thank you very much. Honored to be with everyone here. This is obviously, everyone knows, extraordinary important initiative at an extraordinarily important time. I must say to you all that if you are not anxious, if you are not nervous, if you are not worried and concerned, then you are misreading the contemporary tea leaves. This is a dangerous moment in America's history. And we are at a dangerous moment, I think, not only because of the prevalence and of the Delta variant, the infectivity of it, the consequences of its ability to replicate more rapidly in the respiratory systems of people. But it's also a dangerous moment because we are seeing half of America almost dug in, and they are being just so overwhelmed with misinformation and so overwhelmed with politicization of this tragedy. This is a very definitive moment for shaping not only whether we get out of this pandemic, but shaping the future of the nation. And so institutions like our barbershops and beauty salons, the cultural life of the Black community, this is important. And I am overwhelmed as I conclude my introductory comment. I am overwhelmed that so many of our beauticians and barbers have taken the call that says, we intend to be relevant to this historical moment, and we tend to be relevant to the solution of saving Black life. That is as high and as noble a mission as anyone can have. And so all praise is due to our beauticians and our barbers.
You know, Reed, literally right now in the chat is a team of barbers out of Denver, Greg and Chuck, and they literally said, we're having a vaccine clinic in our barbershop right now.
Wow.
And they have tuned in for us. So Greg and Chuck, we're going to be calling on you in a moment just to share in real time what's happening. And here's that silver lining. Who could have imagined that by being thrown into the deep end of the Zoom pool, we've actually been able to bring together across the country 1,000 barbershops and salons. We have hit 1,000 brothers and sisters.
Wow.
And now we're going to work on activating all of them to get them where Chuck and Greg are right now, literally delivering vaccines in the shop.
Hey, Omar, I forgot to mention as you introduced me, I forgot to also give credit. I'm not important, but I represent the 4 Black medical schools: Howard, Meharry, Morehouse, and Charles Drew, the National Medical Association, the National Black Nurses Association. So I want people to know, our barbers and stylists that are watching this show, that what you have available to you as your partners are the entire brain trust of Black medicine in America. All of us are joined together, putting every bit of our personal reputations and our scientific knowledge in partnership with this initiative. So I just wanted you to know the kind of firepower that is behind this.
Well, you know, Dr. Tuckson, you are correct. I knew that, and we should have mentioned that, because that's important for people to know that there are people who look like them who are at the table as well. And so we are very intentional about making that statement as well. Well, Dr. Scott Harris, I want to start with you because I do know that you have a kind of short time with us. Again, you know, we were able to get several people, a lot of people vaccinated, and people felt that they had done their duty not only to themselves, to their family, but also to their community. And now you're asking them to redo some of the things that they thought they had gone past. How do we go back to people after they did what they should have done, and now you're asking them to go back through the public health mitigation measures?
Yeah, we're trying to make sure we give people the right message. You know, I think a real important part of the message is what Dr. Tuckson just told you. We are in a really difficult, scary time right now. You know, I think there are a lot of ways that this Delta variant, which is the strain of the virus that's circulating in all parts of our country right now, it's almost like a different disease in a way, just in terms of what we thought we knew about who carried it and how easy it was to spread and how easy you could spread it even if you were vaccinated. We're having to relearn lessons. And so, you know, we get a lot of criticism a lot of time in public health about we change our advice and we used to say that and now we say this. And the reason is that the situation in the world's changing. You know, the virus itself is changing, it's mutating. We have to change with that. And we're just trying to give people our very best advice so that we can help keep people safe.
Well, let's talk a little bit about the Delta variant, because you know, obviously it's more contagious, if you will, than the first Alpha virus. And so let's talk a little bit about that and kind of frame the issue in terms of the Delta variant.
Sure. So, you know, all viruses are really maybe all kinds of infections. Once they invade your body, they can start changing, they can mutate. And, you know, what viruses do is they take the cells in your body and they turn those cells into little virus producing factories. And so the cells in the body of a person who's infected is making new virus all the time. And that virus can spread to other people. Sometimes that virus changes over time in your body. If we say it mutates or you get a new variant. And that's what we have now. We have a strain of the virus that's just so much easier to spread. Now, we don't necessarily know yet if it's more dangerous, if it causes worse disease. Some studies say it might, and others say it's not any more deadly, but it clearly can spread to people a lot more easily. And so just by virtue of infecting more people, we're going to see more hospitalizations, we're going to see more deaths just because more people are likely to get infected. You know, here in our state, we're down here in Alabama in the deep South. You know, we thought we had a pretty good situation just last month. You know, in June, our case numbers were pretty manageable. We didn't have a lot of people in the hospital. Our vaccination numbers have not been good. We've got a long way to go to have good vaccination numbers. And yet we weren't seeing a lot of disease. But what has happened in Alabama, just like the rest of the country, is we've seen the emergence of this particular mutation, this Delta variant, and our case numbers are going up just at a rate we've never seen before. We've got more than 5 times as many people in the hospital as we had just 3 weeks ago. That number's increased 5-fold. And so unfortunately, I don't know when that's going to get any better unless we can motivate people to get out and get vaccinated.
Well, you know, let me bring Dr. Landers on as well. And I see we are joined by Dr. Carol Ritter, who is kind of one of the staples with us. Hey, Dr. Ritter, how you doing?
Hi, I'm glad to see you all tonight.
Yeah, good. Dr. Landers, you know, Dr. Harris made a point that somehow, you know, people are not framing the issue properly to talk about the fact that public health is backtracking or whatever. That's not the way I think we need to frame the issue. That they are following the science, they're following the virus, and then they're updating, right, rather than changing messages. How do we now make sure that we are using the proper language? Because if you use the wrong language, it creates more cynicism.
Right, Mayor. And I think
Somehow you froze on me.
Here
just
she's
to
back.
reiterate what
You're
Harrison
back.
said,
Okay.
we have to. Am I back? I think I've been freezing just a little bit here off and on, so I apologize. But I think the most important message that we can get out right now is to remind people that, first of all, all along, since we have had vaccinations, if you're not vaccinated or if you're partially vaccinated, your risk has not changed. And that we absolutely must remind people that if you're not vaccinated, if you're not going to be vaccinated, you need to follow the mitigation. That has been what we have said all along. What has been added here as we have seen the Delta variant emerge is the need for us to vaccinated people. Our vaccinated people have already a layer of protection here, and that layer is being vaccinated. But given the Delta variant and given the small but possible risk that persons with vaccine can be infected, we do not want to give this virus another opportunity. And I think that's a point that I've tried to make to people, is that we've been giving the virus too many chances and too many opportunities. So my understanding and my discussion of this is that we are adding a layer for our vaccinated people to further reduce any potential for transmission of this virus. I mean, we know that vaccinated persons have generally a less severe course, less hospitalizations, less likely to die. It's not zero, but it's significantly less. We also know that in our vaccinated population, that persons, while they may get infected, are less likely to be transmitting at the level of viral load that our other patients. So again, we have to add a layer here for the protection of everyone. This is just a time, as you said yesterday, Mayor, absolutely for people to come together regardless of their political beliefs or other factors, and just come together and take care of one another and keep everyone safe. Thank you.
Dr. Harris, Dr. Landers is correct. If we could just do this, and I'll be okay if I just got my shot, and you have to just be okay if you get yours. It's not like that. We can only be okay if everyone is okay, right? And talk a little bit about how do we get people to understand that you are not just okay just because you got your shot. That's why it's important that we do what I'm terming as promote your protection, meaning to let people know if you've been vaccinated, and to encourage others in your family, in your community, in your church, wherever you are, to proudly say, I'm vaccinated, and that I care enough about you to ask you to do the same. Isn't that something that we need to begin to reframe the issue in terms of you're not okay just because you're vaccinated?
Mayor, that you said that perfectly. I mean, our actions do affect other people, and we all live in communities. We all have relationships with people who are families, our friends, our church workers, the people we work with, people we do fun things with, and what we do really does affect other people. Now, you can do that either way. For those of us who are vaccinated, being vaccinated helps protect those people around us, although we do need them to be vaccinated too to help protect us. There are some people, though, who think if I don't get vaccinated, well, that's just my choice, and it's up to me. And if I get sick, then that's up to me. But we really want people to understand that those decisions make a choice. Make a choice for some other person who may not want to make that choice. What we know about this Delta variant is it's so infectious. Probably every person who gets it is going to pass it to 3 or 4 other people. At least that's what we're seeing right now in Alabama. Now, those 3 or 4 people might be your children, might be your parents or grandparents who may not do very well if they get infected, even if you're a young, healthy person yourself. But almost certainly you're going to pass that to other people. It could be a stranger at the grocery store. It could be somebody at your church that you really care about. But either way, our actions do really affect other people. And we need as many people vaccinated as possible, because that's how we keep this disease at bay. And that's how we finally get back to the normal life that we want to get back to.
I want to go ahead, Dr. T. If you want.
I just wanted to say that, I understand exactly what you've said. And yet I'm hearing a lot more of me. In fact, I'm hearing less of the greatest hits on the conspiracy theories and a lot more of, well, it's me, it's my body, I'm not affected. And I'm not sure where all that's coming from. We have lost the we. Now, Dr. Ritter is practicing physician. She's seeing patients. They're coming into her office. She's encountering this every day. Are you hearing we, or me, or the greatest hits in conspiracy theories, Dr. Ritter?
Yeah, the conspiracy theories are mostly with the outliers, and mostly in Europe because they're mandating it there. And because we're not mandating it here, it's hard to do the conspiracy theories that the government wants to take over us. But the virus, the Delta, is more contagious. And like Dr. Harris says, it actually, when you can track it, it's 1,000 times more viral load. And it's the viral load that makes it more contagious. And it happens in 1 day instead of 5 days like the Alpha variant. So we're seeing this virus being smart, and we have to be smarter. It's so smart that it's more contagious and it's a higher viral load, and it finds the cracks in our vaccine. But what I wanted to talk to you about is a new study that just came out about healthcare workers who are not vaccinated yet. And they studied this because they had recognized that they had put out 36 mass emails over 5 weeks to the healthcare providers to get vaccinated. And now they have a percentage of healthcare workers that are still not vaccinated. I mean, these are the people that have to like go out there and basically advocate for health, right? And in a pandemic, they're not vaccinated. So why aren't they vaccinated? Well, they put out personal emails to them, and one of the 2 personal emails they put out, and one was talking about the personalizing it as a social norm, like all of your other healthcare providers around you have done it. And then the second email was about juxtapositioning the risk of COVID and reframing the risk, in the way that it's like gonna hurt somebody. But either way, they put out a personal email, and this is where it comes to like the barbershops and whatnot. It's a personal conversation that basically addresses them, and whatever it was, the personal email increased the vaccination rate for unvaccinated healthcare workers by 3.6%, 3.6 times. So the personal connection is real. And they say, why didn't they do it with the mass emails? Well, there was competing demands of their attention. There was behavioral inertia. There was the unwielding process of trying to get an appointment. I mean, so all these like things that like tripped people up, but ultimately it is continually a personal connection with somebody you trust that will make somebody who's not vaccinated vaccinated.
Thanks, Dr. Ritter, for that. I want to, because I know Dr. Harris is going to have to leave us. Man, I don't want you to leave, but so I always want you to know that. I never want you to. Every time you got, it's hard to say goodbye. That's a song, isn't it? but anyway, I want you to talk a little bit about that because Dr. Ritter makes a salient point. If the medical professionals are hesitant, then what do you think is going to happen to the general population, right? You can't teach what you don't know, and you can't lead where you don't go, right? And so what do you think the remedy to address the conundrum that Dr. Ritter just raised with the medical professionals?
I would say, Mayor, Dr. Ritter hit the nail on the head. It's a personal connection to people that works the best. We have struggled with this in Alabama, and you and I have talked about this many times. We have, just because of Alabama's history, just because of the way historically African-American people, for example, have been treated in our state, there's a lot of people who see someone like me and they're real suspicious about what I say, and I don't blame them. I mean, they should be. in a way, just because of the history of our state. And so, as you and I've talked about many times, we've worked with you and worked on ways to try to address that. But ultimately, people want to get their advice. They want to learn things. They want to interact, and they trust with people that they know, people who are in their community, people that they see as someone who has their best interests at heart. And that's something we haven't been able to do with me in another city on a TV screen giving medical advice, or even doing a PSA with a celebrity or an athlete or somebody who's famous, but people don't necessarily know in person. The way we really overcome these concerns that people have is it's really kind of one person at a time. But it involves just working in communities with people who are trusted in those communities. And that could be, a local official or a faith leader, or it could be, a local celebrity. But a lot of times it's just your friends, it's your family. It's just people that we are just trying to kind of reach one person at a time. And so we understand that that's where we need to get to, but sometimes it's been hard for us to get there.
Dr. Harris, number one, I want to hear more of you as well. So I hope this is not the last time we see you.
He's going to be back on. I mean, I just don't want him to leave now. But in terms of him coming back, that's a given. We can count that already. He's going to get him back. We just got to get him on a schedule where we can keep him longer. But I want to introduce Dr. Tuesday Cook to him.
Yeah, and just before that, I just want to comment to say that the barbers and the stylists are that new asset to bring into the conversation, like the ministers, like the elected officials. They have the trusted venue and they have the trustworthiness with their clients. They are a new agent, in a sense, at the table that we have not mobilized in this way before. Now we've mobilized them all over the United States.
Right.
Go ahead, Omar.
Yeah. We have a vehicle now to really reach into the community in what we call trusted information centers, which are our barbershops and our beauty salons. Dr. Cook, how are you doing?
I'm doing well, thank you. How are you, Mayor?
I'm doing fabulous. One is I want you to introduce yourself to my best friends. You have to realize if they're in Alabama, they're my best friends. Dr. Scott Harris and Dr. Karen Landers, who are both with the Alabama Public Health Service in Alabama. And so introduce yourself, and then let's talk about trusted messengers.
Oh, okay. Well, I am Dr. Tuesday Cook. I am a fellowship trained minimally invasive and bariatric surgeon in the state of Maryland. I trained at Howard University, both for medical school and for residency. So from early on, I've actually had a very deep and vested interest in the care of people of color and Black people in particular, and disenfranchised people. I do weight loss surgery and I do general surgery. So all my big title stuff is really just to say I do big operations through very tiny holes, and generally have really good outcomes. And it's in being allowed to have people trust me to operate on them, because I look like them and I speak like them and I understand what it is to live in this country as them. That makes me feel like I am kind of fulfilling one of the missions of my life. And in being able to talk to all of you here in the orientation also makes me feel like I'm fulfilling a mission, since, a day at the barber before I got married. And so, I know how important your business is and how much you are trusted. There were times when we couldn't go anywhere because, there were certain clients that came in on a Saturday and he had to be there because they would not sit in anyone's chair. So, people really trust their stylists and their salon members, if only to spread information from the community. It is a very, very safe haven and a place that we go regularly. So besides church, where I grew up, besides churches, you would find salons kind of everywhere. So I think it's important that they are, and you all are, part of the conversation that we have to, and message that we have to spread in our community to make sure that we do not remain disenfranchised and we do not remain at the lowest ends of the totem pole with regards to vaccination status, increased death numbers from COVID-19, especially because a lot of us are people who, or a lot of people of color are people who were not able to stop working, et cetera, during the height of COVID and still cannot. So it's important for us to make sure that we keep each other informed and healthy.
Thanks, Dr. Cook. Dr. Scott Harris, I do know that the 30 minutes that you had allotted has come. So I want you to give us your closing statements. You know, again, I want you to understand the audience. You're talking to barbers and stylists. Many of them are in their shops right now with clients, and they're watching you on big screen TVs and other handheld devices. So I want you to speak to them from your heart, not as this guy or this top medical person in the state of Alabama. That's who Dr. Scott Harris is. Not from that place, from the Scott Harris that people have come to know and love. That's where I want you to speak to them from.
Mayor, thanks for this opportunity. You know, at the end of the day, we're all here to take care of each other. That's my personal belief about why I exist on this planet. And I do my best to try to remember that in my interactions with people. And this is really an opportunity, one of the greatest opportunities of our lifetime, to really be able to do that in a way that will touch people in a way we might never get a chance to do again. We have a terrible pandemic going on right now. It is in Alabama and everywhere disproportionately affecting our communities of color. It's also affecting, you know, other people as well. We've lost, you know, over 600,000 Americans to this disease.
Yeah.
We have a chance to make a difference. And for those of you who are watching this, the people who know you, the people who come in and talk to you, who tell you about their family, who talk about what's going on in their life while they're seeking your services, those are people that will listen to you. They're people that trust you. They're people that will take your word for things. And so I would encourage you to please educate yourself so that you feel comfortable making a recommendation. You don't just have to listen to me. Listen to these other experts on the screen who can tell you as well. Please take on this responsibility to look after those people that you know and care about, because this is really a pivotal time in our history, and we know you can make a difference.
Thank you so much. Before you leave, we're about to build a word cloud. And the word cloud really reflect your emotions and your feelings right now as we speak, knowing how the Delta variant is looming, not only in Alabama, but throughout this country and the world. What's your thoughts now? What one word reflects or can kind of encapsulate your feelings now, Dr. Harris, before you?
Mayor, it was different before I sat down for this talk, but I'm going to say hopeful. I'm hopeful.
Thank you.
And now, you know, you did a preamble different before you sat down. Did this give you some hope?
Yes, that's absolutely what I meant. Like a lot of you, it's been a really long, hard day, and it's been a lot of conflict, and it's been a lot of bad news as we look at numbers. But, you know, just being with this group tonight makes me feel hopeful. I appreciate that.
Well, thank you so much.
Yeah. Well, the other thing is, before you leave, man, remember that we love you, right? And that we want you to be okay as well. So you take care of yourself, your mental health, right? Your physical health and your spiritual health, right? Because we need you around, okay?
Thank you.
Take care
Thank
of
you
yourself.
for letting me join
Thanks, man. Thank you. All right.
Hey, Mr.
Dr.
Mayor,
Scott Harris. Yeah.
I just wanted to say thank you for bringing your colleagues from Alabama on the front lines to our discussion here. And I was so glad that Dr. Harris gave us that word. I wanted him to give that preamble. Just coming in this space gave him hope. And so one of the things that we're going to do to build that cloud for all of you out there listening, we're just going to let you use your chat. Just use the chat. Open up the chat. And I'm going to, when I say go, just type in words separated by spaces. Do not hit return. Just type in words separated by spaces, not sentences, words. And then the staff behind the scenes will go into the chat and build the cloud for us. But this is going to be like they call it a waterfall. Just put the words in, do not hit return, and then I'll count you down and we'll hit return all at the same time, and we'll have a waterfall of words.
Right.
And so, Mr. Mayor, I think there's something about coming into this space, meeting the barbers and stylists, and realizing that there is help out here, that they truly are at the tip of the point of need.
Right.
And what a better place to be to find out the pulse beat of what's going on. So these words are going to tell us something. I'm going to count down from 5, 4, 3, 2, 1, hit return. And my team, Meg, go ahead and start building the cloud, and let us know when you start adding the words so we can watch it grow.
Okay. All right, Dr. Landers, I want to piggyback on what Dr. Cook said, and even Dr. Harris before he left. You know, this whole notion of trusted messengers. You know, I always trusted my physician, but what I find is that many people do not have a relationship with a primary doctor or physician, and so they don't. You know, they have a relationship, and it's oftentimes negative with hospitals in terms of how they're treated. Dr. Cook talks about it all the time, that there's disparity in treatment for Black people than white people in many of these hospitals as well. So as Maya Angelou says, that people will soon forget what you do or what you say, but they will never forget how you made them feel. Right? You see what I'm saying? So how do you get people who've had negative experiences with, not historically, we talk about Tuskegee in a historical context, but I'm talking about contemporarily, with hospitals and healthcare facilities today? How do you get them to move to a place of trust?
Well, Mayor, I think you continue to challenge us with these questions, but also this is a very important part of what we do in public health. Again, we do know that persons do not always have primary care relationships, specifically in Alabama, where there are persons that are unserved or underserved in the community. And I have to experience that myself, because we have caseload of patients right now that get tested for COVID-19 that don't have a physician. And so we have to
She'll come back.
divide that group of health
Okay.
and be able to communicate and carry that caseload and work with those patients. And for me, again, as a physician with a number of years of experience, I'm sure you all can tell that from looking at me. I've been around for a while. It is very important when we are messaging, even in this kind of setting, or when we are talking to patients, talking with the news media, that we come across, that we deliver the message, first of all, with empathy, with caring, and also with openness for personal questions and to want to be part of the conversation. So I think in building trust, you again have to tap into your own ability to communicate with patients. You know, some doctors do that better than others. Dr. Cook, Dr. Ritter, I'm sure you all know that's not a talent that every physician has. But why are we even here as physicians? Why are we doing this? What drives us? And for me in this pandemic, some of you may have heard me say, I actually delayed retirement from the Alabama Department of Public Health because I could not leave the department when we had something like this going on. I mean, I've trained my whole career for something like this and hoped it would never happen. But we absolutely have to be able to be open to persons' thoughts, understanding, and feelings about this, and not marginalize it and not minimize it. I mean, obviously, I did not have the experience of Tuskegee. I knew about it. I learned about that when, you know, I was in college, actually learned about this, but at the same time, we have to understand that history in order to be open to the experiences of people who have had those situations occur that have led them to have less trust. Thank you.
Yeah, thanks so much, Dr. Landers. Dr. Ritter, I want to bring you into this because I've not seen a kind of collective voice of physicians to say to the public, we've looked at this, we've seen it, and we believe in it, and we believe that you should do this. And because we do know that there's power in numbers. Would it be beneficial if we saw 10,000 physicians, 20,000 physicians sign on to this whatever it is, what do you call it, a survey or whatever, that says that we believe in this and it's okay. And so we began to see physicians from all over the country saying the same thing, speaking with one voice. And I think what is creating more hesitancy is they're hearing people from different spaces saying in different ways, and it's confusing people. Can we find one voice to say to the people, this is what we need to protect and to save ourselves?
There's definitely power in numbers, and there's power in the collective voice. And I agree with you. We don't have that in the medical community. And what COVID has been almost biblical. And it has really shown us the division in healthcare. And not everyone in the medical field has gone into healthcare for service reasons. And that is, I think, the problem, because we are all here on this panel to serve. And there's a generousness, a generosity to that. And not everyone gets it. But I do believe that there are communities that get it. And I do believe that we can't do things the same way post-pandemic that we did pre-pandemic. And then we are in a transition. And part of the transition is for us as physicians to recognize that there's other community people that can deliver healthcare probably better than us. I recognized my inadequacies in delivering healthcare in this pandemic. And part of it is because of the color of my skin. And it really is not, not a bad thing to recognize that. It is a recognition that we need to collaborate and trust each other and communicate with each other and advocate for each other in ways that are effective. Because our healthcare system right now, the way it's delivered, is not effective in this system. And if we did get more doctors recognizing that and believing that the barbers and salons can deliver healthcare effectively, we will really see equity of healthcare in the future.
Dr. Cook, you always talk about the need for diversity at the table. See, it's a difference when you are just out here and people are using you as a spokesperson, for something, but you're not at the table where decisions are being made and policies are being made and all of that. They just use you for a showpiece, kind of a person that's a figurehead, right? And it's frustrating to know that you're at the dinner, but you're not at the table. And if you're at a dinner and you're not at the table, then that means that you're on the menu. And so how do we get in the room where things are happening? Because oftentimes what we find is that the people who are making decisions really don't get it. They really don't. And I see it even as they use terminology that does not resonate, it's not culturally sensitive, that they don't get it. How do we get the right people in the room?
So I think that's an excellent question, Mayor Neal. I think it starts at so many different levels. With regards to what you said about the physicians having, a unified voice, at that point, I think you have to remember physicians are people too. And so everyone has their own different ideas. Now, granted, we all agree that we see decreased deaths. We all agree that we see more beds in the hospitals that are empty and in the ICUs that are empty once people started getting vaccinated. But, some of the same discussions you have with patients are some of the same discussions you have with colleagues, which is why you would find so many of those people unvaccinated, yet caring for people and trying to make sure their views are heard. With regards to a seat at the table, I think it has to start from the ground up. And I give an example. When we, an example of something, let's say something I do, and everybody has a voice, but something that I do. For example, I got asked to give a talk to the New York State school counselors about COVID-19, its traumatic effect on school-age children. Now, that's not my expertise, but I know a PhD psychologist who is a child psychologist and is amazing at this. So I connected her with the person that asked. And again, boom, you have somebody who now can speak to people who are a majority, not us, but teach our children and counsel our children about what they can do and what they can be, who don't always understand it from a personal standpoint or from I live in this area and I'm at this socioeconomic standpoint. And so once we get somebody once we speak to each other and tap into each other, that in and of itself is power. Any connections we can make, that's one way. Each one teach one. If you can't do it, you can find someone who can. That's one. Another thing is how you vote, when you vote, find out who your elected officials are. You write them letters. They probably have me blocked from the number of emails I send from my council people to my, congressmen to my, you name them, they probably have received a letter from me. And all you have to do is type in your zip code and put, elected officials 11210. And you find who they are and you tell them what you need and what you want. Because from the ground up, from the person who thinks that they have the least power, you actually have just as much power as anybody else. You just send those letters, you get involved. When now I sit on multiple committees, and it takes time to do these things. But if you sit on the committees, then you can say, wait a minute, I don't like what you're saying. This is how it affects us or my people. And so this is what I actually think you should do. And some people, they don't know they have bias. And some people know they have bias. And some people that don't know they have bias actually are willing to hear what you're saying and learn because they couldn't have the perspective you have. So when you bring your lived experience, that in and of itself has value and can boost up any conversation at any table. So the way to get a seat at the table really is to put yourself out there and say, oh, I'm willing to do that.
Go ahead.
Yeah.
Go ahead, Dr. T.
I'm listening to Dr. Cook, and I'm listening to all the folks we have here in Hollywood Squares, and they're hitting the communication right on target. This is not what I'm hearing from the national news. They open up with CDC reverses, CDC backtrack, like something's wrong, rather than they're updating the guidelines based on new information. And so the comment in our chat from Ms. Broadwater, I think, is important. She's sharing what she's hearing from the people sitting in her chair. She says, I'm hearing fear of the unknown. And every time we make a change, it's like we add more unknown. There seems to be, they seem to hang on to the small percentage of bad things happening instead of the larger percentage of things going right. Bad news leads the headline. A lot of our good stories, Mr. Mayor, that we've shared coming out of this whole experience, when they finally do get in the paper, and many of the papers, they live behind the paywall. If you're not a subscriber, you can't see those stories. We got to figure out a way of getting.
That's Mr. Broadwater. Make sure you correct that. That's Mr. Broadwater.
Mr. Broadwater. My apologies.
Right. All right. Go ahead.
Yeah, don't get me in trouble.
That's what I say. We correct that right away, Mr. Broadwater. We got that. All right.
We have Gregory Allen out there in Denver, literally doing a vaccine clinic in their shop right now as we speak. And here's our brothers from Denver. Go ahead, Omar.
Hey,
Bring
what's
them
going
in.
on? How y'all doing?
We're doing very well. How are you guys doing?
Good. Tell us what's happening out in Denver, Colorado.
So currently we have 3 nurses, one doing check-in, one giving shots, and one watching out for people as they are being observed after the shots. We consistently trying to encourage people to get shots. There's been some amazing turn of events where there's some guys who I started talking to yesterday. They told me absolutely no shots. I'm not going to do it. And they got the shots today, and one is filling out the paperwork today. And I told them I just care about them too much. And that's why I'm so hard on them and I want them to get the shot. It has nothing to do with whatever cycle of bad news and wrong information. It is really, I want you to be protected so that you can protect yourself and your family. And what I'm learning is that it's totally discouraging to hear no all the time, and knowing how much this is our only offense against this particular disease. And when I hear that people are only playing defense and hiding and masking and social distancing, I ask, in any sports program, you got to score points. So the only way we score points is to get the virus. And so these people
Get the
are making me
vaccine.
so happy.
Get the vaccine.
Not the
Sorry,
virus.
Neil.
That we I have to correct when it happens,
Thank you.
because you have people saying, we got to get the no. I knew what you were saying, but we want to make sure we correct it right away.
Thank-
Go ahead. Now keep going.
Thank you. And so I think we're right around 10 people vaccinated for today. And
That's
what we're hearing
great.
from the health professionals is that if you reach double digits, things have slowed down, that's pretty good. And so I'm feeling really encouraged. And we've already scheduled our next one for the next time. We have Shop Talk Live. So that's an event where we actually talk to the community. Our conversation this time will be about vaccine hesitancy, and we'll try to do signups during then. So we've had what turns out to be a good day, and so we got a few more people protected.
Well, let me say this. Let me say this, man. Thank you so much. We are so proud of you and the folk up there in Denver, because this is what it takes. And somebody asked me, well, what if just one person comes? I said, well, tell me this. How do you quantify the value of a life? Tell me, how do you measure the value of with one life? And when you look at it, one life is worth it. If we can just save one person, then it's worth it. And we need to see it from that vantage point as well. So you all have had 10 people, and not only we believe you saved 10 people, but as we see the virus can spread, you probably save family members and friends and others who would be vulnerable by being in proximity to those people as well. So the benefit is exponential. And so we appreciate what you're doing.
So let me just say this, because we often get the question, how many? Now, we all remember when we came back from, thanks for that tour. Keep going, walk us around your shop. When we had these big, massive clinics, thousands, hundreds of people getting at one time, we're at that hyper local. 10 is great, man. That's great, because you also had some of those folks who were saying, hell no, just 24, 48 hours ago.
Right.
So there is now if they walk out proud of what they've done, they're going to go back into a community where that hell no was the norm. And they're gonna,
So this is significant, Dr. T. The guy who said hell no walked out saying, now you get your shot. So he went from I'm not getting the shot to now telling people to get over there and get your shot.
he's an evangelist now.
You have to think about it. We need
Yes.
ambassadors.
Absolutely.
Right? That's one of the things we talked about before. We have to promote our protection. And I think it's even more with the new Delta variant. We need to protect our protection, because if we don't do this, then we could very well have a virus mutate and create another variant that can elude our protection. And that's why it's so important that we become very proactive in really getting people to understand that we're all in this together. Man, I'm so proud of you all for what you're doing out there. And you got somebody next to you. Obviously, I can't let you talk and not let him say something.
I'm Chucky's partner. And what we're trying to do here, we're just trying to save what we can. You know, we're trying to do things one person at a time, you know, one haircut at a time, one life at a time. That's our motto here. One of the biggest things that we want to do is sit back there and get back to normal.
Mm-hmm.
You know, we kind of want to adopt that, saying that you guys want to get back to normal. Let's get your shot. Let's all get your shot, and I think we'll be better for it.
So, you know, I'm listening to our friends in Denver. I listened to Dr. Harris before he left, and this is that word cloud. Dr. Harris left hopeful. The stories out of Denver give us all hope. And look at this cloud, Mr. Mayor.
I see. Do you see how big informed is? Prayerful, faithful. And then we go into things like valued, awake, empowered, previously optimistic, glad, hopeful, protected, educated, inspired, determined, trustworthy, focused, vigilant, alert, wide awake. And I think all of those things are very important because, you know, one is we have had, and I want to bring you, Dr. Landers, on. We've had a lot of disinformation that's been spread, and I think intentionally. At first, I thought it was just ignorance, right? And then I found that there are people who are actually spreading disinformation so that people will not get vaccinated. When you are fighting against disinformation, how do you make sure that the proper information wins over disinformation when it's so prevalent? And I know I keep asking you the hard questions because I just kind of know how you gonna respond. So you can. I guess because I love you, that's what you need to understand.
I was just going to say that is because Omar loves you. And Dr. Landers, as you respond, look at that cloud and draw out anything that strikes you.
Well, thank you so much. And again, I'm used to the hard questions. I've been doing this for a while, but I think the important information that we have to get out when we are speaking about disinformation, misinformation, absolute falsehoods, or whatever you want to call them, the most important thing we can do when we deliver a message to come out with your facts. I need your facts. I need you to be confident and competent in what you know about this. And of course, for me as a physician, as the other physicians obviously on here know, we have to remain science-based, fact-based, literature-based. And in spite of everything that's been swirling around us, we absolutely, cannot relax, if you will, on knowing what the facts are, what the science says, because you have to be able to quote that. And you have to be able to counter that. I look at whatever the disinformation, the misinformation, whatever people are asking me about, and I develop usually about 3 points of why you need science behind it, because this is the information behind it. And I really let people come back to me with the but what if, or I heard so and so, and I remind them, what is your source and what are the facts behind that? So I think it's critically important. I just heard Dr. David Kimberlin today, and again, the physicians on this call would know who Dr. Kimberlin is. He is the editor of the Red Book with the American Academy of Pediatrics, a well-known pediatric infectious disease. And Mayor, you're going to find out who he is and you'll want him on your program because he's right
Right.
here in Alabama.
Well,
again-
what we need to do is I want you to cast him for me on my show. You know, I know you got the hookup.
Well, I'll actually text him, but I think the important thing is he actually focused on myocarditis occurring in COVID disease and helping people to understand that myocarditis was a very significant risk in COVID disease in children as well as adults. And then really brought home the fact that you are much more likely in your lifetime to be struck by lightning than you are to get myocarditis from the COVID vaccine. So again, fact-based, literature-based, and yet at the same time be able, when you're talking to any group, to tailor it to the understanding of the particular group that you're working with, which I have to say that I think Dr. Ritter and Dr. Cook, you both do that so well, and I've learned a lot just listening to you all today.
You know, Dr. Landers, you are right on target. And we have our barbers there from Denver. And I know in Maryland and around the country, sometimes folk want to fuss. You know, they want to fuss about, will my DNA get changed? And so, you know, our barbers and stylists are not geneticists, but sometimes in the setting of a barbershop, they just want to fuss. But when we bring the health professionals in, now they can ask the question. And so I'm curious, both in Denver and around the country, as you're listening, when the health professionals come, do they ask those questions that they've been asking you guys before they came? Do they leave with their questions answered? It's possible to be hesitant on the way in, get vaccinated, and still be hesitant on the way out, which means that the conversation needs to continue to give people greater confidence, even after they make the decision to get vaccinated.
You know, go ahead.
I think that's a very good point. You have to make sure that people feel confident in the information you've given them, but also that they have their questions answered. You know, again, I'm in addition to my other line of work, I'm a TB doctor. I've been working TB control for my entire career. So, you know, one of the things that I've learned, again, is the other physicians, you know, have said here is, what else do you need to know? What questions do you have? How did you understand what I told you? And just basically ask people to repeat things back, because sometimes you think you've communicated and then you find out that that's not what the person heard. It's what you said, but it's not what you heard. So I think continuing bi-directional communication is very, very important as we do this. And even when I have people say that, but what if, but you know, I saw on the internet, and again, going back to reminding people, you know, what is your source and what is the background of that? And this is the information I have. And of course, I'm fond of quoting the many, many experts that I'm privileged to know in this particular field. But again, making sure that you are factual about your information, being able to share that, but also not closing the door. You know, if people say, well, I still don't, you know, I understand what you're saying and I believe what you're saying, but I'm still not going to get vaccinated. You know, I think it would be very easy to say, oh gosh, you know, well, I've done everything I can do. Instead, you need to say the questions you might have. You know, I hope you'll come back and let's continue this conversation. I don't think we want to close the door on people, because as the gentleman in the barber shop said, you know, I'm going to have to really get my motivation from you all here. I mean, you turn somebody around in 24 hours on this. So we absolutely need to keep the conversation open and let people know that if they change their minds, that your door's still open and, you know, your needle's still sharp.
You know, something that's interesting, Dr. Landers, and to all of the other panelists, is that when people get the proper information and then understanding, because it's a difference between just getting information and not getting understanding. But when they get the proper information and understanding, then I believe they naturally gravitate to take care of themselves. I think oftentimes we don't frame the issue properly. So I want to go back to you, Dr. Cook, because, you know, – 'Cause, you know, sometimes it sounds like it's over people's head when we're talking about medical issues, right? And we're talking about variants and, and Delta variants and Pookie said, what's that, a new dance? I mean, so how do we translate? How do we use language that's culturally sensitive and at the level that people can understand?
Right. So I think, again, excellent point. In fact, that might be the most important point made today, because we can, spot off the mouth about all kinds of things, but if our message is not received by the people for whom it's intended, then it's a waste of everyone's time. So, one thing I do very often in the office, again, I feel like it's a service to be able to take care of people and operate on people that trust me to have them put to sleep and go into their bellies and do the things I need to do, remove their cancers or take out part of their stomach or whatever. But before I can do any of that, I need to get their consent. And so, making sure that patients understand exactly what's happening is a key component of surgery. Any kind of medicine you do to a patient, starting them on a medication, making sure they understand their blood pressure, their type 2 diabetes, their cholesterol, why they should take the medication they take. All these things we should be speaking to people on the level at which they understand. Some people have a first grade education, some people have a PhD, but guess what? The PhDs still may not understand the medical terms you're using. You want to make sure that you explain it in a way that folks will get it. So I use pictures. You can use pictures. Sometimes I go online and I print off things that I know are a trusted source, and I'll give it to them. So I'll explain it to them at the level at which they understand. I'll ask them to explain it right back to me, like Dr. Landers indicated earlier. I'll ask them questions. So what am I going to do? What's a possible risk of that? Same thing with the COVID-19, getting the infection, the vaccine. What about it? So, what is COVID-19? How do you get it? Can you get it through your Zoom interaction? No? Oh, okay. What is a vaccine? Why are you nervous about the vaccine? Well, let's answer some questions. Really making sure that you get in it with them. Talk to them like you vested in their health, because you are vested in their health. Talk to them like you care, because you do care. A lot of times people won't listen, or patients won't listen if they think you don't care. If they don't understand or they don't think you'll care. So even when I send them home with those papers, I'll say, okay, when you go home, read that. We've spent 15 minutes talking about it here. Read it. If you have a question about it, call me tomorrow, during lunch, on your lunch break. Call me during your break at work and ask me whatever questions you have. Or I'll see you in 2 weeks, or I'll see you in a few days. Let's talk about it again then. So, or, here's something to read. Ask me some questions. Talk to your next doctor. Ask them the same questions. See if our things match up. I'm not trying to, bamboozle you. I'm trying to leave you hoodwinked, but because you develop a rapport with your patients and they trust you, you then can give them this information. But you have to make sure it's at the level at which they understand, that they can tell you the same thing right back, and that they feel free and open to ask questions. Not that they feel intimidated, like they don't want to look like they're dumb, and so I'm not going to ask. I don't like that. They know. Talk to me, ask me. It doesn't matter, what it is. Just make sure that you ask, because I'm going to get mad if I just spent 20 minutes talking to you and you don't. Get it. They know. My patients know.
I got that look. I can imagine where your children, if you say your mama got that look.
My children and my patients, they know.
They know. Just look at that look. I'm telling you.
Ask me. I'd rather explain it 10 times than you walk away and we have spent the time and you still don't get it, because the whole purpose of this discussion is for you to get it and for you to make an informed decision. And the more information people have, the better decisions.
You are muted for some reason, Dr. Cook. Okay, there you
go.
Oh,
no, I'm muted because I said the more information that people have, the better decisions they can make.
Yeah, thanks. The point of the matter is, and I want to go to Dr. Ritter, and I know you have some comments, but I want you to know that what Dr. Cook said is correct, and Dr. Landers as well alluded to this, and even Dr. Harris did. People don't care how much you know until they know how much you care, right? And so I think we need to get to a point of just humbling ourselves, right? And just really getting to a place of humility to say, we're here for you, right? To just take the temperature down a little bit. Even for the people who are in that space of hesitancy, we need to take the temperature down a little bit and be more patient with people as they process what they're going to do with their bodies and their life. And I think we need to, give them permission to have agency over their own lives. At the same time, get them to understand the interrelationship and interdependency we have with each other, particularly as it relates to a pandemic.
So
How do we navigate that, Dr. Ritter?
and just before you speak, Dr. Ritter, don't lose your thought. I just want to point out, as Dr. Lander said, our brothers in Denver did a conversion on the spot. And I think it's directly related to the relationship they have with the people that they were talking about. And those are relationships that even the physicians, were they to have them, would value them, because they see their people more often than you see them in the doctor's office. So these are real partners here. Dr. Ritter?
Oh, yes. Mayor Neal, I was actually going to bring up that concept of humility, because this is still a novel virus of which we know not everything. We know a lot of data about the vaccine right now. We do not know a lot about this virus and the natural process of it. In particular, I listen more than I talk now in the second half of the pandemic, because I'm learning more from the people who have been affected by the virus and how they've been affected. I don't know if you about Clubhouse, but there's a group of long haulers on Clubhouse who talk about their disease, and they talk about themselves as being two different types of COVID survivors. They call them the Tylenol and Gatorade survivors, because they were not sick enough to go to the hospital, and we as physicians have never seen them. Some of them have never been seen by physicians, so their symptoms have not been documented. But they are out there, and they are a group, and they are finding each other, and they are talking, and I am listening, and I am learning from them. They are the COVID survivors who have been sick enough to go to the hospital, who've got remdesivir and steroids, and they've been documented, and then they've been documented in the literature. There's so much we don't know about the natural course of this virus and long haulers. We have not seen long haulers with a vaccine. And so I really, really, truly, really am just being very humbled by this novel virus that we are continually learning about. And I just like to listen. And when I can give my evidence with the vaccine and the studies that have come out, I give it. And when it's heard, it's heard.
We're going to go to a slide, but one of the things that I want to do as we're going to the slide is to talk a little bit about the fact that we're about to now go into our really those areas where we are in close proximity, schools, colleges, all of those things are about to take place. Football games, basketball games, all of these super spreader events with a variant, the Delta variant, that's more transmissible than others. And that worries me, because I know that when people get in an emotional state, when emotions go up, cognition go down, right? So they're around their friends and they're laughing and they're cheering, and they don't think for that moment that they could be contracting a virus. And so we're going to figure out, how do we do this in that space? Dr. T, you want to talk a little bit about, or let's do this. Can we bring Sebastian on? I have not seen him in a while. Can I just get him to come up? Can we just bring him onto stage? I'd like to see him. I didn't recognize him last time, and I apologize for that. Sebastian is our guru that helps people with their onboarding and help them through the process. So we want to bring him into this space. And Sebastian, if you can kind of tell them what we're doing and how the tech support is taking place and what they can do to access that support.
And let me just say this before Sebastian speaks. As you can see, there's been a lot of activity in the chat and a lot of solutions being worked out in the chat tonight, this very night. And so one of the things that we have done, we've been listening to you, scholars out there, and we're going to do one-on-one tech support. We've been doing that all this week, and we got people completely to the finish line. So please, again, put your information in the chat so that Sebastian can set up a one-on-one appointment to help with all technical issues.
Okay, Sebastian, are you there? Can we pull him up?
So Sebastian had to leave for the evening. But hi,
okay.
everybody.
Meg is there. There we go.
Okay, Meg is excellent too. So Meg, can tell them what we can do to support them.
Hi, everybody. So I'm Meg Jordan. I'm your tech support here for Shots at the Shop. If you have questions about, so the process of Shots at the Shop, you have already completed steps 1 and 2. You're well on your way. So now what you are ready to do is set up an event, or you're ready to join our online course. So to join the online course, you're going to set up an account through our university system. It's not hard, but it's a lot of steps. And so we're here to help you with that process. We have a YouTube video you can watch to do it yourself. We also have office hours for you to sit in a room with us and set that up so that you're good to go and you understand everything you need. I will throw the link for our open office hours, and we have one next week. What day is that, Dr. Thomas?
Well, we'll put it all in the chat. One of the things that we want to do are these one-on-ones, and that has been extremely helpful because we've talked to people who were frustrated, and with one phone call, boom, we were there. So in many ways, what we're learning, Greg Allen out there in Denver, is that our barbers and stylists are at different points on the whole continuum of the information highway. And so actually getting through this will bring us all to a new space to better utilize this technology. And clearly, this is one of the silver linings behind this pandemic. We brought barbers and stylists together all across the country. That's never happened before like this. How do we keep this going? And Greg Allen, you said something. You got a clinic going in your shop right now tonight. And then you said the next one. I don't want to miss that. That means your clinical partner said, we'll come back again. Very, very important. This is not a one and done. It's a new relationship.
Right. Good. Let me say, and you're absolutely right. And that's what it's about, because, you know, we have to, we cannot spike the ball with the 30-yard. That's important. Where am I getting that noise from? Okay.
The tech team's taking care of it.
Yeah, that's fine. Let me say a couple of things, because we're getting ready to wind this down. Can you imagine? We only have 12 minutes left for this. This is how wonderful when time flies, how wonderful things are. Let me ask this, and I wanted Dr. Cook to come back and kind of help me out. Dr. Ritter, I want you to open your mic. Dr. Cook, open yours, and Dr. Landers, open your mic, because I want to have a conversation here amongst the three of you. How do you think that if we gave the barbers and the stylists a card that have the facts and the myths, that would be helpful of what you're hearing? Because a lot of times you can't remember all of this. So if a myth is raised at the shop, they would have a reference material right there. It's easily, digestible and explainable. What do you think that will be helpful? I want y'all to talk that out.
I'll just comment first, and I know that doctors, physician myself, I find it useful. And again, as Dr. Cook said, we're doing that closed loop communication. We're asking people, we're telling them information, we're asking them to repeat back to us so that we know that they understood what we said. But I always find fact sheets very helpful, and the shorter the better. I don't think that whenever we start and everyone looks at it and people want to do 12 pages, no, people are going to look at something, they want something that is very straightforward. They want to keep it in the level of information that they can grasp in a short period of time. So I absolutely think fact sheets and informational sheets, and I like what Dr. Cook said about pictures. I use pictures myself and have done that for years. So I absolutely think that straightforward, simple educational material can be useful in this. Other doctors, I'm sure you have perspective.
Yeah, I want the doctors to kind of help me out. What do we need to do? How do we need to do this? Because to give the tools to the barbers and the stylists. That's what we're talking about, giving them tools.
I like the idea of cards. Even more, I like the idea of like posters. Like when people walk in the shop and they're looking around, see who's there, they might see something that catches their eye. I don't know if you want to put a beautiful woman on it in the barber shop, a handsome man up in the corner.
That certainly brings attention.
Okay, if you want to say, COVID-19 affects, causes erectile dysfunction. I mean, you could put whatever you need on there, but I think if you have something that draws the eye, they hang it up in the shop. So people cutting their hair and, turn the chair and then they're looking at it and they just read it while, they have to keep still. Or, your head is in the wash basin. I don't even care if they put on the ceiling. I have one doctor's office and they put stuff on the ceiling. So while they were examining me, I was looking up at things and it was very interesting. So, I think we have to be, we have to think outside the box in these times that are not usual for us. But on that poster, I think we should put things like, do you think such and such? And then maybe under that put, your DNA actually remains the same, and put a little blurb about it. Nothing too complicated, nothing too wordy, but something that says, I heard that such and such. Well, the truth is, and put the truth underneath it. So maybe we could put like the top 10 myths. So the changing of the DNA, the inserting of a chip.
Right.
I can't have babies, or it makes me infertile. What was the other one? Oh, I've heard so many crazy ones, but
y'all kind of list them out. I mean, I want to know.
Just 10. Yeah. Nothing that's so long that people are not going to want to read it, and nothing that's so short that it doesn't address the major things that we want to address, and just having people take a glance at it. But make it so that the eye is drawn to it, however that may be.
You said 3 or 4. I want to get to
10.
Greg
10.
Gallen and Dr. Ritter and Dr. Landers. What have you all heard something that you say this got to be on the list?
Well, for me, it's the younger generation, and it is the sexy part of it, and it is the fertility part of it. I mean, the older people, 80% of the older people have been vaccinated in the United States now. So for the older people, it's more about traveling to other countries, and they're going to have to be vaccinated if they want to go to another country. That's not in our jurisdiction in the United States anymore. So yes, it's really about vaccinating. I think there's like 100 million people in the United States have yet to be vaccinated, and most of them are under the age of 40. So we have to talk about it in their language, and it usually is sexy, yeah, it does cause erectile dysfunction if you get COVID, more likely, 6 times more likely.
You got to make that number 1 in the barbershop.
and the fertility
lined up for sure.
And the fertility myth, we talked about this at the last one. Hopkins is perpetrating that fertility myth by putting that as an exemption on their COVID vaccine. So we do have a lot of work to do. But yeah, we do need to confront these myths in the younger generation that it's not going to compromise your fertility. In fact, getting COVID is more likely to compromise your fertility.
even at the bottom, you can put little links on the CDC, you know, or, I mean, they can't click it, but they can at least see
Yeah,
a
the
reference,
The
a
CDC
reference.
still does have some weight, yes. So we do need to follow the CDC guidelines, and those are very important. And patients recognize those when they're in their office and they see a CDC sign. They're like, "Oh, she reads the CDC. Oh, she's following the CDC. Oh, we have to trust that." Still, I mean,
So when we look at Denver, and this is just a thought, as you walk around your mirrors, as you look at what's on the board behind you, I wanted to share this from one of the sites, and we're collecting these from around the country. And so we want you to send us your posters, your examples. We want to lift this up and highlight what you're doing. But I thought the creativity here
I love that.
in this piece
Yeah.
coming out of Virginia was just amazing.
Yes, I love that. Where's that, Hampton? All right,
Yeah.
Hampton.
And this is the kind of talent and creativity that we have out there among the
That's
barbers
nice.
and stylists. And so we want to replicate this, make this available to you.
Back to excuse me, if the team in behind the scenes, if you all could mute whoever it is. Okay, thank you.
Yeah.
Go ahead.
And so one of the things that I wanted to say is that, listen, this is a 100-year event, this pandemic we're in. 50 years from now, they'll be talking about this. The Library of Congress has reached out to say that the materials and the things that we're doing, they would like to archive in the National Library of Congress. So I think that we need to recognize the historic moment we're in. I was just so pleased when I saw this, and we want to find out how we can help all of you have really engaging posters and other kinds of recruitment materials, and how this same technique can be used to dispel myths and misconceptions.
Thank you so much. Dr. T, I'm looking at the clock on the walls, and it says it's time for us to begin to giddy up out of here, as we say down here. But I would be remiss if I didn't get some closing comments from everybody. The guys over in Denver, man, again, kudos. Thank you all. Honor to you and the work that you all are doing. We really appreciate that. It's I don't want you to think that it goes unnoticed. For everything you do, both seen and unseen, we are appreciative of you. So thank you for doing that. If you could start out with you all, and then I'm going to end up with Dr. Tuckson and then Dr. Thomas, and then I'll bring it home. But we're going to start with the barbers. Take a home message which you give to the other barbers and stylists that they may be able to give to their clients.
So a realization that I had is that too often we have people who aren't knowledgeable sitting around talking to other people who aren't knowledgeable, and then you have this circle of misinformation going around. What I think I observed today is that inserting myself in a way that both I care about the individuals and I have good information, created an opportunity for them to stop looking at each other for the misinformation and then start thinking about it differently. And so we got to tap into anybody who's influential in these circles and say, just insert yourself in the middle and just speak truth, plant the seeds, and change happens.
Yeah. Your partner?
We're just trying to educate the man in the chair. That's what we're trying to do. We're going to educate the man in the chair.
I love it, man.
Right.
Even loud.
I like that. So you've given me an idea. Dr. Landry, you are, this is your first time with us, but I promise you it's not your last, right? You'll consider yourself a part of our team now, right? And, what would you like to be the takeaway this evening to the barbers and stylists that are out there listening to us?
Really, the most important message that we can have here is that we all need to work together. We need to bring out the needle on a a manometer, if you will, but not move the, but get the needle in the arm. So I think it's extremely important that we bring our collective experience together to be able to move forward in a manner that can affect not only the individual's lives, yes, the man in the chair, but also the men that will come in and occupy that chair afterwards. So thank you so much. I'm going to use that line.
Thank you so much. Dr. Carol Ritter, so wonderful seeing you again. Thank you so much for your willingness always to be present, not only to be listening here, but also to share your truth. What's your last statement?
For us as movers of the truth and health, to follow our hearts and to listen as much as we speak.
Thank you so much. Dr. Tuesday Cook, again, I echo everything in terms of that I said about Dr. Landers and Dr. Ritter. With you as well, you have been a staple. We couldn't do this without you. We really couldn't. And so we thank you so much for your making yourself available to do this work. Your last words.
Well, as always, I'm honored to be invited to attend and serve. That's why I went to medical school. That's why I became a physician, to serve the people who need it. And I think my parting message is probably the same one that I've made the last 3 times. It's really about even the barbers and stylists taking care of themselves. It's tough having a business in this environment. It's tough, making sure your bills are paid, listening to everybody else's problems, and managing your own mental health. So, when you start to feel that anxiety creeping up, or, you're trying to figure out how you're going to keep the shop open and get your supplies and pay your barbers and all that stuff, don't think that you are to be only the counselors for the people in the chair, but make sure that you end up in somebody's chair, ensuring that your mental health is well taken care of as well, because we want to make sure that, yes, our patients and our clients are healthy from a physical standpoint, but we want to make sure that the salon owners and the barbershop owners are taken care of as well.
Thank you so much, Dr. Cook. Dr. Reed Tuckson.
Well, thank you so much. On behalf of all of us at the Black Coalition Against COVID, we just have to say to our barbers and our stylists, thank you for having an undying love for Black people. Do you understand what I'm saying? This is about whether we live or whether we die. If that doesn't get you motivated, nothing else will. And ladies and gentlemen, this is as serious as that. We all need to bring an undying love for Black people, and through that, an undying love for all people. Thank you all for what you do. Thank you all for being here tonight. Do not be discouraged. One life at a time, one day at a time, over and over again. But when you go to sleep tonight, please know that you are committing yourself to an issue that is larger than yourself. This is an issue that is bigger than just you. And my God, your God will shine down on you tonight.
Thank you so much, Dr. Tuckson. All right, Dr. T, you have the bat in your hand and you're at the plate. Knock it out the park.
Listen, I've been so encouraged by what I heard here tonight, and especially our brothers there in Denver. But we got folks from Texas, Virginia, other parts of the country doing exactly what you're doing. And it's working. It's actually working. Now, you know what happens when we do the one-on-one talks, Omar, and we try to get them over the hump? The conversation is not just about computers. It's about life in the barbershop. It's about the struggles with the landlords. It's about running the business. And I think that's one of the things that we want to pay attention to. How can this effort not only help save lives, but help our barbers and stylists thrive as business people, So you should know, stylists and barbers, we've got the U.S. Chamber of Commerce involved here. And they recently held a meeting on the role of barbers and stylists in community health, not just COVID, community health. So as you're talking to the clinical people coming in, giving the jab, Hey, how about some blood pressure screenings? How about some diabetes screenings? How about those social determinants of health that can be addressed? That's a new relationship that we want to keep and maintain and grow and bring not only more business to you, but also more resources. So we're listening. Let us know what you're going through so we can echo that upstream to places that can help make a difference. We do not want our barbershops and beauty salons to be super spreader locations. And this is going to be the differentiator. And I'm just so glad that you're here. And Omar, what an evening we've had tonight. And we got a plan to help people one-on-one to get them on board and over whatever humps they're experiencing in the technology. But as you can see what's going on there in Denver, they're saving lives. It's all worth it.
Absolutely. Well, thank you, Dr. T. And to all of you, Dr. Landers, Dr. Ritter, Dr. Cook, and in his absence, Dr. Harris, you all were incredible. I knew it in advance, so I'm not surprised at all. And I know how your truth has resonated to my family up in Denver, Colorado. I want you all to know you're brothers from another mother, that's all, right? And we embrace you and we love you and we thank you for the work you do, both seen and unseen. You know, you said something that really sparked a thought for me as I give my closing remark. And that is that each of us have to look at the man and the woman in the mirror. It was Michael Jackson that had a song that I'm starting with the man in the mirror. I'm asking him to change his ways. No message has ever been any clearer. If you want to make a change, take a look at yourself. You want to make a difference, take a look at yourself and make a change. And if we want to make a difference, we have to realize that once we know, then we owe. It is not so much that you got your vaccination. Now you must go out and be an ambassador so that others can be protected as well. We need to promote our protection so that we can protect our protection. As always, I like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. Have a wonderful day. Thank you all. Bye-bye.
You got the power. See you next time.